good evening, good night, and welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist, talking all things on living agelessly, bridging generational gaps, family caregiving, entrepreneurship, life itself. So, this is the month of December. I can't believe how, but it's just sped by. And well, it's December, and so what is our health topic for tonight? Wishing you well, those of you in cooler countries where it's snowing. Yay! It's cold for me here, but we're still okay. So anyway, grab your cuppa and join me right now, and we can talk about another taboo subject. I know I've been doing a lot of taboo subjects recently, but you know what? We just need to talk and have the conversation. So we're gonna have the conversation on HIV/AIDS and older persons. Just gonna talk about it. And because it's happening, we have older persons living younger, healthier lives, we have older persons living active sex lives, we have older persons who are going back on the scene, as they say, back out there again. Things happen. What may have happened in the past may now be showing up. So let's talk about it, shall we? Let's do so. So I know it's not probably new to you, but let's just go over what HIV is and then what AIDS really is. So HIV is a virus that damages your immune system all over. And that system is what we need to fight disease. So having HIV, the virus, the human immunodeficiency virus, as its name would suggest, it deprives you or depletes you of your own immunity. So your cells are not as strong as they were. They just can't help you fight basic infections. When it cannot fight infection anymore, and it gets to the point where your cells, your fighting cells, your white cells, your T cells, especially your B cells, those cells that really keep us healthy that we take for granted all the time, when it gets to a point where they have lost their ability, their function to cope, to help you with infection, and you start to get other diseases that wouldn't normally creep up. Let's say the common cold then goes directly to pneumonia, or what you thought was a fatigue feeling, and you get your blood test and it shows your white cell count is almost negligible. Let's do an HIV test. When it gets to that point where the cells can no longer cope, it becomes AIDS, which is not just from the virus, but the virus now has led to the acquired immunodeficiency syndrome known as AIDS. And of course, in the 80s, 90s, this was, most people would have thought this was a death sentence. Thankfully, because of modern medicine, persons being more aware, uh, global awareness and funding and research has led to persons living longer lives, healthier lives, reduced transmission, not necessarily reduced incidence, but we'll talk about that. But it's also because of our aging population, because of persons living longer, HIV and AIDS has now had sort of a resurgence in its appearance. It never went away. It's a worldwide, it's an epidemic, really. It's a pandemic, you could say, but just simmering proportions. But even though in older persons HIV will exist, getting older doesn't shield you from being HIV. It's no longer considered a young person's promiscuous, you didn't know what you were doing kind of disease. So let us talk a little bit about not just what puts older persons at risk, but also what can be done. Yes? And reasons why older persons are at risk is because older persons, there is still a stigma attached. That has not really gone away. The fear of, if I have AIDS or if I have HIV, the entire neighborhood is going to go. No, I'll be shunned. I'll be kicked out of the tribe, the community, and it's basically a death sentence. And that, for some people, that's what they would have grown up knowing is a death sentence. So they're not likely, ignorance is bliss. So if I don't know, can't hurt me. And so older persons tend not to come. And these are people from, well, we know older persons by definition from 65 onward. But imagine, if you will, a 77-year-old female, male, female, who lost a spouse, but who feels in vibrant health because, again, everybody's aging. Well, let's hope everybody's aging gracefully. We're aging like fine wine. And you want to have your social life, and that social life includes being having an intimate partner, thinking of being remarried, thinking of just the companionship of another person. That's the reality. No longer are you going to sit in a corner and wait for death to come. You're going to live your life. And if you're living your life and you're going to be sexually active, the thought does not automatically come, ooh, I need to have an STD screen. That never used to be the key. And what if I do have this thing that I don't want to know? Because I just don't want to know. So most people don't come forward. And until they start to get sick, unfortunately, without that discussion between both partners and without that consent between both partners, honest to do their test together, to reveal their status together, then older persons are finding themselves increasingly, sadly, from the ages of, let's say, even 55 and above, with HIV, challenged with older persons. So that stigma, that shame, that fear stops them from coming to the doctor. Sometimes, unfortunately, the medical community does not help because when an older person comes in, I mean, everyone is not a gerontologist. Everyone is not used to dealing with older persons, and doctors, to be frank, some are not comfortable discussing matters with older persons, especially younger doctors. So they feel it's not their place. But is gonna tell? Who else is gonna make the suggestion? Who else is gonna do the test? Who is gonna make it available? Who is gonna provide the counseling, the safe space? We have many centers, but you come to the physician or any of the counselors or the centers, they have to be able to, one, present it in a non-judgment fashion. Like, what do you want to know what your tests are? You shouldn't be engaged in anything right now. You should be having fun and volunteering, really. So let's just, it is part of our bias as well, I have to say. And some person's bias is just a little more than others and makes more persons reluctant to come get tested. So the other risk that older persons have that the 20s to 50s may not have, let's say, generally, is other underlying health conditions, which may treatment, management, and just the overall health of the person sometimes can be impaired. So an older person may have concomitant hypertensive disease, hypertensive heart disease, high cholesterol, diabetes. They may have had a stroke. They may have kidney problems. They may have cancer. They may have dementia, let's say, early, or cognitive impairment, I should say. And before that's realized, all those treatments and requirements of those treatments and complications of those medicines themselves can complicate the treatment required in management and care of HIV and AIDS. Not to mention the repeated tests, not to mention the costs, And some persons, older persons especially over 70, 75, in many countries, thankfully it's changing in some, but in many countries, persons over 70 are no longer getting health insurance. And yet they're starting to have more health problems. So imagine you're adding another disease onto this, which requires medication, which is costly, in addition to their own prior medical conditions. What are they to do? So some persons feel that ignorance is bliss. If I don't check, then I don't know. I'm just gonna do it happily. No, because there is something that can be done. But that's knowledge is potential power, right? So we work with what we know. But the fact is, the number of, according to the CDC, Center for Disease Control, the number of older persons with HIV is increasing worldwide. And it seems to have, in all the COVID and all the other diseases that have come, it seems to have become slightly forgotten, but it's very much still out there, and research is really, really trying to kind of remind persons this is still here, this is still causing a problem. Vaccines are still very slowly coming for HIV, very slowly coming, because the virus changes so rapidly. So protection is not quite the same. Remember how HIV is spread? Sexual intercourse direct, so that's male to male, male to female, oral sex, anal sex, and well, that's on the sexual side, and contaminated blood or contaminated organs, but that's less. Or if the person may have been using drugs which require, when I say drugs, I mean drugs for recreational drugs, which require injections. Those persons are also at risk because they tend to share needles. And if you're sharing a needle with another person who doesn't even know that they're contaminated, and this is older persons too, some of them, think of it, have been displaced by society, by families, by circumstance, by whatever, into living in communities where they're not supervised, they're not safe, and they have to be in a community somehow in order to get food. And so they sometimes find themselves at risk of these things. These are the realities that we keep hush hush. But let's open the dialogue for this, please. Hushing it, hiding it, doesn't help it. Just feel so passionate about this because it can be dealt with. So the stigma, the embarrassment, talk to your doctor. You know, you may have to pray about it, talk to the person that you trust the most, and say, well, and if you have a potential new partner, take the courage and talk. You know, older persons that say, I'm old enough to do da da da. I'm old enough to speak my mind. Speak your mind. You are free enough to do so. And insist that you both have a test. Ask your healthcare provider again whether testing is right for you, what other tests you may need. You may need to have other STI screenings, that sexually transmitted infection screening, not because you may have a disease, but because you want to at least have a baseline. And also remember that because of years ago, yes, but also new diseases are resurging that can make management of HIV more challenging. So, or make your risk of contracting HIV higher. So, herpes, chlamydia, gonorrhea, HSV 1, 2, yes. Herpes, gonorrhea. There's another one. Don't, yeah, you do this every day. But those put you at higher risk for contracting HIV. Think about it. So, an STI screen, an HIV screen, those are warranted. Now, we talked about the risk factors. We talked about older persons. Is there a difference between older males and older females? Oh, that's a big question because I've had that question so many times from all the patients recently. So doc, should the females get more tested than the males? Because I heard that the females can spread it more, or the females can catch it more than the men. Okay, here's the thing. Everybody's at risk. If you're exposed and you're having unprotected intercourse and you may have a risk for HIV, you know, all bets are off. All decks are out. All cards are dealt. However, for females, and this is why for females it's so important as well, because in sexual intercourse, for a female who's an older person, there's vaginal dryness, which means as you get older, there's not more there are more, no more hormones, as many hormones to keep the vaginal canal lubricated. There are some gels that will help with that, but generally speaking, it's not as lubricated, doesn't produce the environment for sex as it would have before, because many of the persons have gone for many years without intercourse. Hormonal changes have happened because it's dry, because there's fewer hormonal stimulation. It makes intercourse and the friction of intercourse create bruising in the presence of male, especially male to female or female to male, female to male intercourse will can cause, well, we're talking about females really, but it can cause the bruising. This is because of hormonal changes. Bruising in the canal, which that bruising can lead to yourself being exposed to the virus that comes through the ejaculate of the semen of the male. So females, older females generally will be at a higher risk simply because of just that hormone change. But it does not mean that women are higher risk or catch it more than males, and so males don't have to worry. So we've talked about the transmission, we've talked about older persons, we've talked about the stigma, we've talked about testing, we've talked about communication. Now let's talk about if you are going to be sexually active as an older person, by all means, it's part of ageless, normal living. Aging is not a disease, it's a process. You're living your life. You're living. Some of you are maybe having a second life. You've thought maybe I can't do anything now, but then you feel good and you want to explore life in a new way. So have the conversation, have the conversation together, then may have the conversation with the doctor and talk about testing, yes. Talk about the other diseases you may have, other conditions, how it can be managed. Have your pre and post test counseling, that is always advised. And doctors, colleagues, please remember older persons do have active sex lives. They are not just grandma and grandpa sitting down on the couch, rocking chair, just knitting and speaking wise words. They're having their life as well. And so remember that older persons just ask the question, bring it up. Bring it up discreetly. You may have to bring it up more than one visit. They may not initially come up front and say, yes, this is what I want to do. But let's reduce the stigma and the shame around it so that we can reduce the incidence of it happening, because barrier protection, medication, and just general education can reduce the incidence, and then all the trauma and all the depression, all the things that go with having a disease now that's there with you. So as an older person, know what your risks are, know how to know, follow your doctor to get tested, speak with your partner if you're having a new partner. Don't feel ashamed to come and get tested. Doctors don't make the conversation easier. If you're at risk with multiple partners, or you're now starting out again on the game, so to speak, the I should say game, on living life in a different way or having the new openings, then by all means have treatment. There are many testing centers, and everyone's is very discreet. So let's have the conversation, have the treatment, take away the stigma, and remember to discuss all possibilities. Any facts that you're not certain of, anything that you're uncertain to get tested, where you can get it from. Remember, just ask. Just a few reminders: you cannot get HIV from sharing a drink with someone, from sneezing, from coughing, from sharing utensils. You cannot get it from mosquitoes. For sure, you can't. You cannot get it from giving blood. You cannot get it from kissing, from hugging, from shaking hands, bouncing, using a public telephone, using a swimming pool, using the same restroom. You cannot get it from those. It is blood or body fluids contact. So I hope this is able to be of some service to you, caregivers, family members, friends.